Thank you so much for joining us. Welcome to the Smart Hospital Podcast. This is where we sit down for short, focused conversation with healthcare leaders who are responsible for real operational outcomes inside hospital. Not theory, not sound bites. I'm your host, Chris Darius, founder of Facility One. We bring senior healthcare facility leaders in small, intimate, invitation-only events setup, which is designed for meaningful conversation and measurable progress. Today, we're going to talk through facility leadership, infrastructure priorities, and how decisions are actually get made inside a health system. Today, we have joined with us Brent Rutherford. Brent leads facilities and environmental services at Texas Health Resources and brings deep experience across hospital operations, capital planning, commissioning, and workforce development. Brent, thank you so much for taking the time to join us. Let's start with immediate questions right in front of you. What are the few facilities or infrastructure challenges you're currently navigating across your organization, Brent, where you and your team are feeling the most pressure right now?
Probably one of the biggest challenges that healthcare facility managers are dealing with is in a renewed focus from the Joint Commission, DNV, those deeming bodies for CMS, to maintain temperature and humidity requirements within the operating suite. If you deviate from the 68-degree temperatures that are minimum acceptable levels per APIC and several of the other entities, how are we managing that process, and how do we maintain proper humidities in a warm, moist locale such as Texas or along the Gulf Coast, and even into the eastern coast where it's warm and humid? How do you manage that, and how do you document it? And so those are probably top of everybody's mind, because I know as surveyors, when they come out to your facility, they walk in an operating room, they feel it's 64 degrees in there, they're going to comment on it. How are you managing this? How are you documenting this? And so that's one of the very largest focuses that we have to deal with right now.
Well, in regards of the priorities, like for the upcoming 12-month priorities, looking ahead, what priorities or projects feel the most critical for you over the next 12 months? Like, are there any specific capital initiatives, operational upgrades, or infrastructure investments that's on top of your mind currently as we move forward?
Yeah. The hospitals are always, that's one thing about a hospital. There's always a project going on. We here at my hospital, we've got an end of life issue with the surgical light booms. So we're having to replace all of those aging booms, room at a time, while maintaining a very active surgical schedule. And so coordinating those moves. We also have radiology equipment and cath labs. They're wanting to do a cath lab renovation project in the next 12 months that will require a lot of coordination and oversight, and then just keeping the lights on, making sure that everything is done effectively and efficiently, monitoring your utility uses. There's always something going on. And then, of course, with all projects, making sure that the life safety features and the environment of care items are maintained to current code.
In regards of, like, since as you mentioned, like upgrading, there's always a project going on, right? So you might be working with different solution provider or a vendor that we call in regards to it. Now, when it comes to evaluating a new solution or a partner company, what tends to matter the most in your decision making? Like, is it the proven outcome, ease of integration, long-term support? What exactly that you're looking to first when you actually vet those solution providers?
Yeah, what I like to do, and what, in my opinion, makes the most impact on any project, any job that we encounter, is building a relationship with that vendor and that contractor to make sure that they're not just there to get it installed and walk away. They're going to be there to support it over the life of the device, over the life of the space, and can bring, you mentioned integration, with the Internet of Things that we have today, there's always advances with the AI that's coming. How do we safeguard improper access, but how do we maintain that cutting edge intelligent design to make sure that we reach what end result we need, and can we continue to adapt as things continue to evolve and come on board?
Interesting. In regards of the decision-making process, I'm sure you have a team that you coordinate with. How are the decisions for project like upgrading or retrofitting your facilities typically made within your organization? Who needs to be involved? What does a realistic decision timeline usually look like out of your experience?
Yeah, for medical equipment, being part of a very large organization, we've got, I think we're approaching close to 30,000 employees spread across about 14 million square feet of property, all confined within about 200 miles of each other. But it's a large organization in a small region serving about 27 counties here in North Texas. And so when we go to do a radiological upgrade, the radiology team at corporate has selected vendors in whom they want to work with. And so each individual hospital just reaches out to that particular vendor. We're doing a bed replacement project here in the next 2 or 3 months. There's a contracted provider for the bed manufacturer that we go through. And that takes a lot of it out. But if you're in an individual hospital where you're trying to figure all those things out on your own, where I've been in my past, you have to sit down and have meetings with those individual providers and look at the different pieces of equipment they have. Typically, we go out and look at other applications where they've installed in other organizations and see how it went, get the information from those contacts so that we can have conversations with them about what went well, what didn't go well, how can we partner with this vendor well, how did they support them after it was done. And so those are all things that go through for my organization. Once a project is conceived, it's probably a minimum 6 months to a year before it gets acted on, because we want to make sure we vet everything out. If it's a new piece of equipment, we've got to make sure all of the utilities connect easily. It fits through the doorways we have. If it doesn't fit through doorways, what walls can we take down? How can we get it to fit in? Is the location landlocked? Are we going to have to build a new building to house the new device? Those are all things that go into it. And so there's a lot of moving pieces that it just takes time to get through all the vetting.
You mentioned about vendor relationship earlier, working with different vendors. Since as pre-call, you actually mentioned like you have been in the industry for like 13, 14 years. And in regards to you have worked with wide range of vendors and partners over the years, right? From your experience, what has worked well in the past vendor relationship?
It's basically taking time to meet with those vendors and like I said, building those relationships. As my efforts for 7 or 8 years being directly tied to infrastructure project management, working with each of those vendors on the RFP process, going through what are our needs, building the owner's requirements for a project, and making sure that the vendor understands exactly what we want. And if you don't lay it out and specify those requirements, you end up with a very big void in your project. And if you don't specify, you may not get the right contractor. And so the contractor needs to know what you need, regular interactions with them, going to the location where it's going to be installed, walking the space, making sure they understand everything that's required to access it. Sometimes you have the benefit of that contractor's been on campus for the past 10 years. They know where all the skeletons are, where every closet is that they have to go access. And it's real easy. Other times, if you've got a new building and a new contractor, you're going to have to spend a lot of time with them, showing them everything, not just a blueprint. You're going to have to walk them to each closet, because there could be some very large encumbrances of getting to different spaces that they need to be aware of so that they can give you a good contracted price without coming back and saying, oh, I need a change order because I didn't know this was here. I need a change order. I didn't know that was there. And so you have to make sure that everybody is fully aware of all of the challenges to provide either the regular service or a project initiation to completion. You've got to make sure that they're fully aware of all of the challenges that are in front of them.
The quality engagement that you mean, like that was the next question that I was supposed to ask you, which there's one part of that particular statement that you actually made. Now, solution provider or technology partners who wants to work efficiently or effectively with facility teams, what is that one thing which they understood better before starting the conversation itself, Brent?
I do so much partnering with a lot of vendors over the years that they really have to come in and be willing to listen to what the pain points are without trying to interject solutions initially. Those that come in and hear about half of what you're trying to say and then say, well, we can do that, really puts kind of a strain on that relationship building, because they may not, what they're proposing, we may have already tried and we know doesn't work, and we need more deep investigation into what's going on, or we may need them just to hear out everything we've tried. And so there's a lot that I put into that human communication component before we ever walk out on the shop floor or up on the roof, depending on where we're looking. We need to have that conversation of these are our pain points, these are all the things that we're struggling with. And then when they have the full picture and then you go walk the space, you end up having a lot better outcome and understanding of, oh, I can see how this would be a problem if, for example, a variable supply box for HVAC, we struggle getting in to work on it because when you actually take the ceiling tile out and look and you get up above the ceiling, there's sprinkler pipe that runs right next to the access door. And so you can't even get into the access door without moving the box out of the way, which means you've got to disconnect a bunch of things. And so being able to just understand everything that's going on and then coming up with solutions that are rational and efficient and economical from the project standpoint. And sometimes you may have to spend a little bit of money to move something just because it's in the wrong location. And that's one of the reasons why we did the major commissioning project and management component on major projects, to make sure that those things were looked at before they actually got fully completed and ceilings put in.
That's fantastic. Now, since we're coming up to the end of the full cycle of our conversation, like Brent, there's one last question that I want to ask. Being the veteran in the industry, being so much experienced in diversified roles that you have taken upon throughout your career, what's your take on AI within the healthcare facility?
I think AI has the potential to be a very strong support in terms of ongoing continual commissioning of systems once they're installed and functioning. We'll take HVAC, for example. There are so many individual components that go in to maintaining optimum temperature for the lowest cost. I think there's a huge opportunity for that robust AI number crunching to look at all the variables and say, this one piece of equipment is starting to fail. If you replace it, you can save $10 a minute, whatever the metric is. Right now, we don't have the capability of evaluating all of those variables together. We can look at one variable at a time. We can't look at 100 variables combined. And I think that's probably the biggest opportunity for AI. I think there's also a lot of opportunities for AI that could be negative. I do not see AI as being able to reduce workforces, which I've heard proposed. It's not going to happen. You still got to have the people going out, turning the wrenches, making sure the pumps are turning out and doing the things that need to be done with a pair of hands or two pair of hands. That is always going to be there. But those deeper diagnostic things, I think AI has a huge opportunity.
Fantastic. Well, Brent, this is a very great conversation that we had. You gave us a very practical conversation that we had in regards of how a healthcare facility navigates, what's your pressure points these days that you guys are facing. And thank you so much for giving your insight. We're looking forward to continue this conversation with the other senior leaders from your organization at our Future Healthcare Facility Summit this September 2026 in Dallas, Texas. Thank you so much for joining.